honored to be on this stage. Can you imagine sharing a stage with such incredible people who are trying to transform healthcare? I want to say a big thank you to Startup Health for allowing me to have this opportunity to stand before you. My name is Brandi Harless. I am the CEO and co-founder of PreventScripts. Dr. Natalie Hodge and I founded PreventScripts after moving home to Kentucky and finding our friends and family suffering and sometimes dying from diseases we knew were preventable. Things like obesity, diabetes, and hypertension. And it led us to ask a question. Why in a world where we know how to prevent these diseases are we not making progress? It is our belief that we're leaving out a very important group. Primary care providers are the front lines of our healthcare system. And we believe that they are part of the solution to start making progress on this issue. The only problem is they are not finding revenue sources to support them in this effort. We are struggling to provide them with prevention practices that actually work for their practices, and our incentives are not aligning properly. So we are on a mission to empower the 1.7 billion people globally who are at risk to live without pain and suffering of preventable diseases. And we want to do that by transforming primary care to be the true front line of defense against preventable hypertension, diabetes, and obesity. So we all know the team makes the difference, and we believe we put together a strong team to accomplish this. While I had the privilege of going to great schools like Vanderbilt and Boston and working at Harvard, the thing that ranks the top for me and the opportunity that I was afforded the opportunity to help expand access to primary care in Western Kentucky, attracting the Commonwealth Fund to study our success. Dr. Hodge has served and practiced in primary care for over 20 years in rural, urban, and telemedicine settings. And our third co-founder, Jay Campbell, is a former IBM software architect who successfully exited a company in the internet service provider business in the 90s. So we have built together, along with our great advisory team, a prevention management platform that provides primary care providers with that new revenue source that they need by focusing on their pre-disease population. Now, everyone believes their approach is unique. There are a lot of people trying to solve for this, but we truly believe that this in-clinic revenue generator that we are creating will make the difference for primary care providers to truly be on the front lines against these diseases. We've also combined the approaches to diabetes, hypertension, and obesity into one product to make it simple for our primary care customers to implement in their clinic and with their patients. We've had great early success with a small patient sample, but more importantly, we are now working with a large health center network in Arkansas, Kentucky, and Mississippi to continue to prove out our model. And additionally, we will be onboarding a private practice with 20 providers supported by VillageMD in the coming months. We also were identified as by the Healthcare Finance Management Association last year as a much needed and intriguing company towards population health and analytics. So here's the deal. We've got to do this soon because our primary care providers are continuing to lose revenue, our neighbors are continuing to be more unhealthy, and reimbursement incentives for proactive prevention are starting to align. So now's the time to act. That is not mine. I'm gonna go back. I don't know your pitch, sorry. But I'll tell you, I was reflecting on this quote behind you as I was coming up, and it says, with the right mindset, a moonshot vision, and the spirit of an entrepreneur will achieve the impossible. So I hope that you will join us on our mission to transform primary care to be the true front lines of defense against things that we know to be preventable. Thank you very much.